Hello everyone! Welcome back po sa ating channel. Again, my name is Joel Pasqua, a health educator and a nurse by profession. And for today's topic, we are going to discuss the nursing process. But before we proceed to that, guys, please don't forget to subscribe to our channel para updated ka sa maraming videos natin. And of course, hit the notification bell para mariring ka lagi kapag may mga bagong videos tayo. Huwag din kalimutang mag-like and also comment for your suggestions na mga topics na gusto nating i-discuss or gusto nyo may discuss natin for the next videos. And of course, para ma-shoutout na rin kayo sa mga next videos natin. And share this with your friends who are interested in nursing concepts. Okay, just like I said earlier, the topic that we're going to discuss today is the nursing process. This nursing process is a very important concept in the practice of nursing. Why? Because this is actually the core of our practice. This makes as different from other nursing, from other medical practitioners such as your doctors, medical technologists, respiratory therapists, and physical therapists, and so on and so forth. Okay? Ito yung nag-separate sa atin sa mga professions na yun. That's why the nursing profession is existing because of the nursing process. Okay? So let us go on with this video and define. Okay, define what is a nursing process. According to the book of Fundamentals of Nursing by Cozier, okay, Cozier and Herbs, nursing process is a systematic and a rational method of planning and providing individualized nursing care. Nursing care to whom? Of course, to our clientele or to our clients. Now, it says there it is systematic. Why? Because we follow a procedure. We follow a step-by-step system in order for us to provide, the best quality of care that we can give into our client or for our client. Of course, in every action we do, it has a rationale or it has reasons. Hindi po gagawa ng action ng isang nurse whether in the community or in the hospital or in other fields of nursing practice setting nang walang rason yung ginagawa niya. There is always a reason why we perform certain interventions, certain actions in taking care of our client, and that is actually included in the entire concepts of your nursing process. Now, in performing or in doing your nursing process, once you go now to take care of your patient, these are the characteristics of the nursing process that we have to bear in mind. Kailangan lagi nating tatandaan ito in order for us to provide the best quality of care to our patient. Number one is we have to remind ourselves that nursing process is cyclic or cyclical, and dynamic by nature. Cyclical and dynamic by nature means to say that it is cyclical because it is a continuous process. When you say continuous process, paulit-ulit po yan. It will not end for as long as it is needed. For as long as yung pasyente natin is nasa hospital, there must be a problem. Kaya nandun pa siya sa hospital. So it is a continuous process. So we continuously doing the step-by-step process in order to address whatever problems may arise in relation to the care that we will provide to our client. And of course, it is dynamic, it is acceptable, and it's gonna be adaptable, to whoever and whoever clients or patients we have. So that's the first characteristics of your nursing process. Another one, it is client-centered. This is very important, client-centered. That is why, pag sinabi po nating healthcare team, included po dyan ang patient. Take note that we will not have a nursing process. We will not have the profession nursing kung wala tayong aalagaan. Because the word nursing itself, kapag dinefine natin yan, it's caring. How will you care kung wala ka namang aalagaan? So the nursing profession provides services to its clientele, and the clientele are actually the recipient of our service, of the services that we will be providing or that we are doing. Okay, that is why nursing process has to be client-centered. Okay, whenever we set the goal, agenda, the actions, it always to be, we always need to include the client in the performance of activities that we will be putting in the nursing process. Okay, again, tandaan po natin, it is client-centered, not nurse-centered. Okay, another characteristics is the focus is on problem solving, okay, and decision making. Okay, the focus is in problem solving and decision making. The reason we have your nursing process is because there are certain problems that we have identified in relation to the care that we will provide, that we are providing to our client. Okay, and in every problem we do, okay, we have to decide which action is the best for our clients. That is why the focus of your nursing process is the solution, or the providing of solution to the problems that we together with the client identified. And of course, we are going to make decisions with all the assessment data that we have in order to come up with the best activities or actions or interventions for our client. Okay, another characteristics, ladies and gentlemen, is your interpersonal and collaborative style. Ang sabi diyan, interpersonal. Okay, take note, meron tayong tinatawag na intrapersonal and interpersonal. When I talk about intrapersonal, that is your relationship within yourself. Okay, that's how you take care of yourself, how you take care of your things that is related to you. While interpersonal naman po, this is more on social. Okay, social meaning, okay, this is a social, okay, this is more on social, meaning our ability to interact with others. And when we interact with others, take note that it is not only nursing field ang mag-aalaga or nursing profession na mag-aalaga sa pasyente. There are different professions that has to be included in the care that we will be providing to our client. That's why we need to collaborate. We need to collaborate with them in order for us to provide the best quality of care for our clientele. Later on, pag-uusapan natin the different types of nursing interventions, and one of that is your collaborative interventions. Okay, that's another characteristics. Another one is it is universally accessible or applicable. I'm sorry. It is universally applicable. Universally applicable kasi kahit sinong pasyente natin. Okay? Wherever we are, okay, nursing process is actually a universally accepted process. Kung ikaw man po ay nursing student ngayon na nagbabala pumunta ng abroad, like the United States, which very high hiring ngayon, the United Kingdom, the Middle East, or kung saan mo man gustong magpunta, okay, nursing process is universally applicable. Okay, we can apply this process to whoever patient we have and wherever we are, for as long as we are practicing our nursing profession. Okay, so it's universally applicable. Okay, another one, it uses critical thinking and critical reasoning skills. Lagi namin as an instructor po, okay, as an instructor po sa isang university, sa School of Nursing, we always tell this to our students na kailangan whenever you perform certain tasks, whenever you are already in the duty, whenever you are reading your exams, you always need to use your critical thinking and critical reasoning skills. So, and it's the same thing whenever we practice our profession, kahit nurse ka na, registered nurse ka na, we always need to use critical thinking and critical reasoning skills. Okay? Why? Because the nursing process involves caring activities to our client that sometimes may endanger their lives kapag nagkamali tayo. Take note that as nurses, we are handling lives. Okay, that's why we need to make sure that in everything we do, okay, there is a reason, and of course that is the best thing to do at that moment. Kaya nga sabi sa definition ng nursing process kanina, rational method, because there is always a reason why we keep that we are doing a certain activities for our client. Now, since we're talking about the critical thinking and critical reasoning skills, so let's define what is critical thinking and reasoning skills. Okay, so when I talk about critical thinking, okay, critical thinking is an intentional higher level thinking to define client's problem, examine evidence-based practice in caring for the client, and make choices in the delivery of care. While critical reasoning is the cognitive process that uses thinking strategies to gather and analyze client information and evaluate the relevance of that information and decide on possible nursing actions to improve the client's physiological and psychosocial outcomes. Okay, therefore, critical thinking is under your critical reasoning. So whenever you are performing or doing critical reasoning wherein you rationalize, you tend to look or to think for the reasons why you are actually performing a certain things, that is actually critical reasoning. And within critical reasoning, may tinatawag tayong critical thinking. Okay, so whenever you are performing critical thinking and you're trying to connect everything and analyze all the information, you are performing critical thinking. And when you try to define, okay, identify the different um, practices that are already proven or evidence-based, you are doing critical thinking. Okay? So for example, pinag-isipan ko, nilalagnat ang pasyente, inisip ko kung ano yung mga pwedeng gawin. Okay? Ano yung mga treatment in relation to my patient na nilalagnat. So that's critical thinking because I'm defining now. I am trying to think of all the available options that can be used, okay, in order for me to address the concern of my patient. So critical reasoning is that I'm going to choose which is the best, okay, intervention that I can provide to my patient. Okay, para mas lalo pang maintindihan. Okay? Critical thinking, pag naisip ko na pag nilalagnat, kailangan uminom ng paracetamol, kailangan lagyan, magpunasan siya, o punasan siya ng bimpo na nilabhan sa malamig na tubig or sa tap water para mabawasan yung kanyang init ng katawan. Okay? Critical reasoning naman yung pinili ko na gamitin yung pagbanyos ng katawan niya or paggamit ng bimpo kumpara doon sa paggamit ng paracetamol, kasi bilang nurse mas inuuna natin yung mga non-pharmacologic treatment. Okay. So nung nag-isip ako ng mga treatment, critical thinking yon. Critical reasoning is pinili ko yung best treatment for my patient. So that is the difference between critical thinking and critical reasoning skills. Maaring mapagbaliktad natin sila, but in the end, the end of these two skills is to find out which is the best for our client in terms of improving their physiological and psychosocial outcomes. Okay, so I hope that is clear with everyone. So let me continue. Now, when to use critical thinking skills in nursing? Kailan natin ginagamit ang critical thinking skills in nursing? Number one, we use this, okay, when we use knowledge from other subjects and fields. Okay, so nag-iisip tayo. Okay, when we try to define now the problem of the patient, when we tend to use critical thinking skills and try to connect this with the other subjects and fields that we have, especially in the medical fields. Okay, another one is when we deal with change in a stressful environment. So when we deal a stressful environment, yan, mag-iisip tayo, what is the thing that I need to do, okay, during these stressful situations. Okay? And the last one is to make important decisions. Of course, whenever we have to make an important decisions, we have to consider the best options available there. Okay? And in order for us to come up with the best decision, kailangan nating pag-isipan ng maigi. Okay? Pag-isipan ng maigi yung ating gagawin. Okay? Kung ikaw nag-exam, okay, you make use of critical thinking skills in order for you to come up with the best answer. Okay, so those are the moments wherein you're going to make use of your critical thinking skills in nursing. Okay, so I hope that is clear with everyone, and we're going to continue with this topic. Okay. Okay, now still part of the discussion about nursing process. Okay, is your phases. Okay, is your phases of nursing process. So since process, pag sinabi kasi nating process, there is a step that we need to follow. Okay, and in your nursing process, there is what we call your phases, and the phases are known as your ADPI. ADPI. Okay, for us to easily remember this one, ADPI. Okay, so what do we mean by ADPI? A is for assessment, D is for diagnosis or nursing diagnosis, P is for planning, I is for implementation, and E is for evaluation. And this is a cyclic process. Okay, paulit-ulit po yan natin gagawin until such time that we were able to meet now, okay, the desired outcome that we want from the patient. Now, in all these aspects, as you can see in the picture, okay, so it is a cyclical, paikot po siya, okay, and in all these spaces, okay, we make use critical thinking. We make use of your critical thinking in order for us to assess the patient properly, okay, and from the assessment, we were able to come up with the correct diagnosis or nursing diagnosis. From the diagnosis, we were able to come up with the correct or proper planning for the client's care. Then we implement those information or for those plan during the implementation phase and evaluate the effectiveness of everything we did. All of that phases, kailangan natin gamitin si critical thinking in order for us to provide the best quality care for our patient. Okay. Now, since these are phases, there are different activities that we are doing in each phases of the nursing process. So let us discuss this one by one. Let us start first with your assessment. Okay, assessment. If you're already done with your health assessment subject, I believe you already have an idea of what is assessment. Okay, when I talk about assessment, this is gathering, okay, gathering or the collection of information or data. So this is the gathering or collection of information or data, okay. Then after we have collected all this data from the client, we are going to organize, okay, organize all this data, okay, into groups or group them. Okay, for example, we are going to group them according to the types of data that we have collected from the client. Okay, then after after organizing this data or information, we are going to validate, okay, validate the accurateness and correctness, okay, of this information. So validation is basically your verification. Okay, we have to verify. We have to verify if the information that we have collected is indeed correct, okay, is indeed correct or accurate, okay. So we're going to verify then. And after we have verified the information for its correctness and accurateness, we are going to document this in the patient's chart or whatever forms we are using in order for us to make it legal. And of course, this will serve as a communication na din between nurses and colleagues plus other healthcare professionals such as your doctors, medical technologists, physical therapists, respiratory therapists, or other medical professionals that are included in the care of the client. And the main goal of why we do your assessment is to what? Establish a database. Establish a database that will be used in order for us to come up with the best possible nursing diagnosis, then the plan that we need to address the diagnosed problem, then implement it, then evaluate it. Then we are going to go back now to this data and try to compare kung may nagbago ba sa mga data nito after nating evaluate, after nating magbigay or i-implement yung mga planned interventions natin. Again, there are four major steps or four major activities that we perform during your assessment phase. First is the collection of data, organization of data, followed by your verification of data or validation, and the documentation of data. Okay, again, this information that is collected during the first phase will serve as your database. Now, since we are talking about data, okay, data, pinag-usapan natin ang information, there are two types of data. There are two types of data in assessment or health assessment. Number one, there is your subjective data, and the other one is your objective data. For those who have done already or nag-discuss na ng health assessment, alam ko familiar na kayo dito, but let's review this for those who don't have an idea yet. Okay, subjective data is also known as your symptoms or covert data. Symptoms or covert data. Okay, symptoms or cover data. And this data or information can only be provided, verified, and described by the client. Okay, I would like to put emphasis on this one. Okay, can only be verified, perceived, okay, and described by the client. Okay, sir, bakit kailangan may emphasize? Experience ko po kasi whenever I have my duty with my students is that um, whenever they chart, especially kapag ang pasyente is baby, sanggol, okay, sanggol na may sakit or mga bata na may sakit at tulog sila, dadatnan mo, then the student will go to the patient, okay, then tatanungin, since yung bata is infant, of course, hindi siya nakakapagsalita. So, ang ginagawa nila, tinatanong nila yung nanay, okay, or yung bantay. Then the nanay or bantay will tell na parang masakit ang tiyan niya. Parang masakit ang tiyan niya. Then yung your verbatim na yon ng mother, ilalagay nila as subjective data. Wrong. Okay, mali po iyon. Why? Kasi ang sabi, pag subjective data, it can only be described or verified by the client. Ibig sabihin, by the patient. Kung nagsabi man yung nanay niya, okay, na parang masakit yung tiyan niya, okay, or parang may iniinda siya, okay, we cannot put that in the chart as part of our subjective data. Okay, objective data pa rin yun. Pwede natin i-document yun, mother or the caregiver, care provider or caregiver verbalizes concerns about the client's or the patient's situation. Okay, lalagyan natin sa objective data yon kasi narinig natin sa pasyente, but not sa bantay, not directly from the patient. Again, when I talk about subjective, guys, subjective, okay, these are only information verbatimly provided by the patient or the client. Okay, hindi ng healthcare provider or hindi ng bantay. Okay, so kapag yan po ay bata or sanggol, malamang hindi nakakapagsalita, or comatose patient, hindi nakakapagsalita, okay lang po na walang subjective data. Kasi nga, expected naman po na hindi sila makapagbibigay. Okay? Hindi sila makapagbibigay. Hopefully po, maliwanag po tayo dyan at wag na malilito kapag kayo ay nag-start na mag-duty or nag-duty ulit at ginagawa nyo to dati, wag nyo nang gawin ulit. Kasi it's wrong. Okay? Hindi po siya tama. Because according to our book, okay, sabi po ni Kuzier and Herbs, it can only be described and verified by the client. Yan po ang subjective data natin. Another one, okay, these are examples of your subjective data. It can be the feelings of the patient, the values of the patient, the beliefs of the patient, the attitudes, and the perception of personal health status and life situations. Okay, and life situations. Okay, so those are your subjective data. Okay, so now to compare it to your objective data, ang objective data naman po are also known as your signs. Okay, are also known as your signs, and this is also known as your, take note ha, para hindi makakalimutan, baka magpabaligtad, covert, overt, objective data, signs. These are observable data, observable data. So, okay, observable by, it can be observed by the person who is conducting the assessment. Okay, objective, overt, observable data. Okay, kaya nga ang vital signs is an example of objective data kasi it can be observed by the nurse. Okay, it can be observed by the assessor or the observer, or yung tinatawag nating person who's performing the physical exam. And objective data are data that can be detectable, okay, detectable and measurable, okay, detectable and measurable. And okay, this can be obtained through human senses. Nakikita, naririnig, natitikman, nararamdaman. Okay, to the use of your sense. It can be seen, it can be heard, it can be smell, it can be taste, it can be felt, okay, or nararamdaman through our tactile perception. Question now, okay? Madalas pinagtatalunan natin yung konsepto ng pain, okay? Pain. Ang sabi ng pasyente, masakit ang ipin ko. Masakit ang ipin ko. Pain in general is considered as subjective data. So we are going to write the verbatim. Masakit ang ipin ko. Okay? Okay, hindi mo nalalagay ng as verbalized kasi nga automatic pasyente nang nagsasalita dyan. Kasi nga subjective. Okay? Ngayon, objective. Ang pain can also become an objective data. Okay? Paano? If we start to measure it. Okay? Pain scale. Okay? Pain scale of, yeah, 7/10. Yeah. So this is an example of subjective data of pain, and this is an example of an objective data of pain. So yung pain naging objective data na noong measure natin. Kasi nga, it can be measured through the pain scale rating. Take note, kapag measurable, nagiging objective data siya. Pero pag non-measurable, that is subjective data. Again, pain in general is subjective. So you have to write the verbatim of the patient. But if the patient is non-verbatim, okay, and if we want to measure the pain, it can now become an objective through the pain scale measurement. Sana po maliwanag tayo dyan. Again, subjective data, it can only be perceived or felt or described or verified by the client, while objective data are information that is detectable and measurable through the use of our human senses during physical examination or during observation. Okay? And this includes now your signs, your vital signs. So, symptoms naman po, yung mga nararamdaman ng pasyente. Kadalasan symptoms, masakit ang tiyan ko, para akong nahihilo, okay, or nahihilo ako. Those are examples of your subjective data. Okay? So, sana po maliwanag po tayo sa types of data. Now, these are examples of subjective and objective data. Okay? Para mas maintindihan pa natin. Subjective data, I feel sick to my stomach. Okay? Feel sick. Okay? Pag feel sick, ano yung mga pwedeng objective data that we can use in order to justify, okay, or verify the subjective data or the subjective information. These are the objective data that you might that you can observe with the patient. Patient vomited 100 ml green tinge fluid. Objective data yon. Okay, in relation now to the subjective data na I felt sick to my stomach. Okay, another one, abdomen firm and slightly distended during palpation. So when you touch the patient's stomach, okay, it feels firm and slightly distended. Okay. Okay, another one is active bowel sounds. Active bowel sounds naman during auscultations in all four quadrants. So that is the comparison of your subjective data and objective data. I hope that is clear with everyone, and let us continue. Now, these are the sources of assessment. Sources of assessment or information, of course, number one is the client. Okay, especially that the client is the best source of subjective data, or the only source, should I say, the only source of subjective data. It can also be support people, the caregiver, the care provider, the parents, kung sanggol yan, yung bantay kung yan ay comatose. Okay, clients' records. Clients' records are already information taken by other healthcare professionals, but can also be a basis of the assessment findings or the assessment and later on can be used to come up with a nursing diagnosis. Your healthcare professionals is also included, other healthcare professionals such as other colleagues, your other nurses, the doctors, and of course the medical technologists who will now be providing yung mga laboratory tests. Okay, literatures, because these are the evidence-based information that we can use in order to justify yung ating mga information collected from the client. Okay? Okay, the question now is how do we collect this data? So what are the methods that we can use in order for us to gather this information and come up with the best assessment informations that we can use in order to create now the nursing diagnosis, the planning, then implement whatever activities we have, then evaluation and the cycle on the nursing process goes on. Okay, so these are the methods that we can use. First one there is your observation. Okay, the first one is your observation. And observation is the best way or the best method to collect now your objective data. And when we talk about observation, we make use of our senses. Okay, so ginagamit siya during physical examination, ginagamit siya just a simple observation, inspection, o yun ay yung IAPEPA na tinatawag natin during your inspection, auscultation, percussion, and palpation. We make use of the method observation to collect the data. Okay, to collect all the data. Okay, so that is your observation as our first method. The number two is your interview. Interview. Your interview is the best way naman po to collect your subjective data. Okay, subjective data. So pasensya na po sa sulat. Okay, subjective data. And your subjective data includes now your history. Okay, history of the patient. So this includes your history, past health history, present health history, the chief complaint. Ayan, chief complaint. Okay, the chief complaint. Okay, the chief complaint or the reason why the patient went to the hospital or to the clinic for consultation. So that can be gathered through now your interview. Okay, interview. And next is through examination or through examining. Okay, and when we talk about examining, there are two things that we can do here or under this method. Number one is the physical examination. So physical examination using now your cephalocaudal approach. Cephalocaudal approach. So cephalocaudal approach is your head to toe assessment. Your head to toe assessment. Mula ulo hanggang paa na assessment. For those who are having their health assessment, I believe this will be part of your skills. Okay, na kailangan malaman under your health assessment courses or subject. And the next one, still under your examining, still part of the method, is your diagnostic test. So your diagnostic test includes now your laboratory test, okay, your lab test, and this also includes your other test, okay, other test, okay, such as your CT scan, ano ba? CT scan, ayan, X-ray, MRI, and laboratory test, nandyan yung UA or urinalysis, your CBC, or complete blood count, okay, ABG, arterial blood gases, okay, and so on and so forth. Okay, so those are the diagnostic tests, and all of that all of those things are included under examining as a part of the data collection method. Okay, and of course examining, okay, ang nako-collect natin dito is still objective data. Okay, objective data kasi nga karamihan dito is na-observe natin, and of course it has measures. Okay, take note that objective data can be measurable, or it's measurable and detectable using now our senses. Okay, let me continue now with the next part, or the next part of the discussion under your assessment are the types of assessment. So the types of assessment includes four. There are four types of assessment that we are using in the hospital and even in the community. Number one there is the initial assessment. So initial assessment is commonly done to collect your initial database. Okay, your initial database. So these are commonly done sa OPD or your outpatient department, ER, and during the first hour of admission. Okay, first hour of admission sa ward. Okay, first hour of admission to the ward. For example, pumunta ng clinic, nagpa-check up sa'yo, all the information you will collect from that, okay, from that meeting, okay, is an example of your initial assessment. Pumunta ng ER, you're going to conduct initial assessment. Pumunta ng OPD, you're going to conduct initial assessment. Yung pasyente na trans-in from ward or from OPD, okay, to ER, from OPD to ER, then pinunta sa ward nyo, the assessment of procedure that you're going to perform during the first hour of stay of the patient in the ward, okay, is an example of your initial assessment. Another one is your problem focus assessment. Problem focus assessment naman po, these are ongoing assessments. Ongoing assessments, okay? Ongoing assessment. Ongoing assessment siya, problem focus, okay? This includes now assessment data related to one specific problem, okay? Related to one specific problem. For example, during the assessment, during the rounds, nakita mo ang pasyente, hinawakan mo siya mainit, Okay, so you will now focus your assessment in relation to the initial assessment data that you have collected, which is yung mataas ang temperature. For example, pagdating ng vital signs, nakita mo ang taas ng temperature niya, then you're going to assess the other information related now to the increased body temperature, such as your what? Warm to touch, okay? Tignan mo kung pinagpapawisan ba o hindi, meron bang ongoing infection. Okay, so those are example of your problem focus assessment. Or for example, nahirapan huminga. Pag nahirapan huminga, then you will focus on assessment to find out the reason why the patient is having difficulty of breathing. Okay. Another type of assessment is your emergency assessment. So emergency assessment is assessment done during a life-threatening situation. So this is an assessment done during a life-threatening situation. Okay, life-threatening situation. So during a life-threatening situation. Sa ER, madalas ito, even in the community, pag biglang may nag-collapse sa harapan mo, i-check mo siya, sir, hey sir, are you okay? Hey sir, are you okay? You check the pulse, you check the breathing. Those are emergency assessment procedure. Commonly ginagawa sa ER during mga disaster situations. And the last one is your time-lapse reassessment. Time-lapse reassessment commonly done at sinasabi sa pasyente during discharge. So, pag discharge mo sa hospital and you will ask him to follow up after a week, after a month, after 3 months, that's an example of time-lapse reassessment. Okay, for example, na-confine yung pasyente, after ng confine niya, sa last day niya, you advise the patient to come back after 7 days to check yung kanyang health status. Okay, that's reassessment, time-lapse po yun. Okay, kapag siya ay nagre-rehabilitate, 3 months for example, okay, pag pinabalik mo siya after 3 months, that's time-lapse assessment. Pag mataas ang cholesterol, binigyan ni doktor ng pampababa ng cholesterol such as your atorvastatin, simvastatin, then after 3 months, she or he has to go back to the clinic for laboratory test to reassess kung bumaba ba yung cholesterol niya o hindi. And that is an example of your time-lapse reassessment. Okay, I hope everything is clear about your types of assessment. Let me continue now with the discussion about your assessment. Now, dissecting the steps in assessment. So again, there are 4 major activities in the assessment. Okay, number 1 is your collection of data, followed by your organization of data, then validation of data or verification, and your documentation of data. So, tignan lang natin yung each activities under these steps in assessment. Let's start with the collection of data. So, under your collection of data, we are going to gather all relevant information from the client. So, this includes now your subjective and objective data. Okay, after gathering all those information, okay, through the different methods that we have discussed earlier, through your observation, what else? We have your interview and your physical exam and diagnostic test. So after we have collected all the information, we are going to organize them. So use different frameworks in organizing. What are these frameworks, sir? So we can categorize, okay, the information either subjective or objective. We can also organize them according to functional patterns, which is by Margaret O'Brien. So for more information about this one, you can actually check this in the Fundamentals of Nursing book. Okay, we can also organize the data according to Roy's adaptation model. So this she is a theorist, okay, in relation to nursing. Okay, we can also organize the data according to body system, Maslow's hierarchy of needs, and through the different developmental theories such as the theory of Erik Erikson's, theory of Simon Freud, theory of Jean Piaget. Okay, so those are your developmental theories. So we can make use of these frameworks in order for us to easily organize the data that we have. Example of how we're going to organize the data. Okay, for example, subjective data, masakit ang aking tiyan, as verbalized. Then we can take note of the objective data such as your following: abdominal guarding behavior, nausea and vomiting noted, facial grimace, decreased peristaltic sounds upon auscultation, abnormal tenderness upon palpation and percussion, pain scale of 7/10 from the pain scale. Okay, 1/10 10, 1 over being the lowest, okay, it means not painful, and 10 being the highest means painful. Okay, another way of um, organizing the data, for example, with this given situation. So history of diabetes mellitus, bluish is discoloration, abdominal area noted, X-ray results showing enlarged liver, lamp in throat area, noted shivering, noted BP 150 over 10, millimeter mercury, and temperature of 38.9. Pulse rate 87, respiratory rate 19. So you're going to organize them. Category 1, ano yung mga pwedeng magkakasama na may kinalaman sa isa't isa. Shivering can be related to temperature. Okay, category 2, history of diabetes versus coloration, and the BP 150, 110. May kinalaman kasi DM pwede magkaroon ng hypertension, enlargement of the liver, and lump on throat area. So those are ways on how you're going to categorize now that or organize the data. Okay, then after organizing them, we are going to validate or verify or double checking, okay, to confirm the accurateness and factual of the information, kung tama ba siya or hindi. And there are several ways on how to validate information. We can validate information by comparing now your subjective and objective data. Dapat congruent siya. Hindi yung ang sakit ng tiyan ko pero nakangiti yung pasyente. That's not congruent. Kailangan congruent yung mood tsaka affect. Mood is the thought process while affect is the expression of the mood. So the guidelines in validating data, compare the subjective and objective data, clarify any ambiguous and vague statements. Okay, pag may nakita kang mga abnormal findings, you have to repeat them. Mataas ang blood pressure, repeat. Mataas ang pulse rate, mababang pulse rate, repeat. Okay, you can also consult other healthcare professionals to repeat it for you if you want to, just to make sure. Be sure your data consists of the cues and not interference. Okay, cues dapat yung mga binibigay or dinidescribe ng pasyente. Okay, double check data that are extremely abnormal and determine presence of factors that may interfere with accurate measurement. You can also consult, again, you can also consult other healthcare professionals in case that you are not sure with the data that you have collected. Okay, and they use reference books to explain phenomena that are unclear to you. So those are the guidelines on how to validate now your data. So after the data were double checked and verified, we are now ready to document them. So documenting is the recording of data, and it has to be factual, again, according to the principle of veracity. Okay, and factual manner and not interpreted by the nurse. So, dapat kung ano ang na-observe, hindi kung paano mo siya in-interpret. And it has to be verbatim and as verbalized by the client. Okay? Verbatim as verbalized by the client. Objectively and documented as observed. And do not document normal or abnormal to describe observation because the word normal differs from one another. So it is best to describe it the way you observe it. For example, namamaga, wag mong sabihin normal naman yun sa infection. You describe it as inflammation or redness around the wound. Okay. So those are the activities under your assessment data. We are going to end the discussion here, but wait for our next videos po about the following steps kasi mahaba-habang discussions po ang nursing process. So please do watch out for our next video. So that would be all. Bye for now.